Hello everyone and welcome. Today we are discussing diabetes, which is a condition that affects millions of people worldwide and impacts nearly every system in the body. So whether you are living with diabetes, caring for someone who lives with diabetes, or a healthcare professional, this session will help you understand what diabetes really is, why it affects movement and function, and how rehabilitation, lifestyle, and education plays a powerful role in improving outcomes. So according to the WHO, which is World Health Organization, diabetes is one of the fastest growing chronic diseases worldwide, but many complications that are related to diabetes are preventable. So what is diabetes? Diabetes is a condition whereby the body struggles to regulate the blood sugar levels. So if the body struggles to regulate the blood sugar levels, you will have a condition known as diabetes. So the normal blood glucose levels for a healthy individuals are typically uh, between 3.9 to 5.5 millimoles per liter, usually given an average of 100 to 120 milligrams per deciliter. So that is the normal blood glucose levels. So I have said that diabetes is a condition whereby the body struggles to regulate the blood sugar levels. So this happens due to there's reduction of insulin production and poor insulin effectiveness. So the cells that are responsible for the production of insulin, if there is reduction in insulin production, which means there's a problem with the cells that are responsible for the production. Then poor insulin effectiveness. This occurs if there is a problem with the insulin receptors or both. Uh, you can have diabetes if in case there's reduction in insulin production and also poor insulin effectiveness. So this will result in persistently high blood glucose levels, which will occur over time. This will lead to persistently high blood glucose levels. So your blood glucose levels will always shoot up. So if this happens, diabetes will always affect your blood vessels, which are the veins and arteries, your nerves, your muscles, the body organs, and your healing capacity. So the common symptoms that are associated with diabetes include excessive thirst. So you feel you need to take a lot of water. There's excessive thirst than the normal amount of water that you should be taking. Then there's frequent urination. You feel the urge to urinate, uh, the frequency or the urge to urinate increases. Then there's fatigue. You feel the tiredness on the body, the weakness. Then there's blood vision. You will have a problem with your vision. You start noticing problems with your eyesight. Then slow wound healing. So if you develop a wound with the diabetes, then there will be slow wound healing in such cases. So for clinicians, many patients are asymptomatic early and screening matters. So every time a patient steps into the outpatient or the inpatient clinic, one of the screening procedures that should be done is the blood glucose test. Should always screen for diabetes. So let's look at the types of diabetes. What are the types of diabetes? So the first one is known as the type 1 diabetes. This is autoimmune in nature. Autoimmune, which means that it is associated with the body factors. The body is responsible for the type 1 diabetes, and it is known as insulin dependent. Insulin dependent, which means that it depends on insulin and it is often diagnosed younger. It is always diagnosed younger. Then we have type 2 diabetes, which is the most common type of diabetes, and it is associated with insulin resistance. It is associated with insulin resistance and strongly associated or influenced by lifestyle. So the lifestyle choices that you make usually influence the type 2 diabetes. Then it is uh, considered to be increasing globally. So type 1 diabetes is commonly seen in the younger population. However, in type 2 diabetes, it is the most common type of diabetes which is seen globally increasing, influenced by the lifestyle and insulin resistance. So those are the type 1 and type 2 diabetes. Then we have gestational diabetes. So this occurs during pregnancy, and it raises the future diabetes risk. So if you ever experience diabetes during pregnancy, you have a risk of developing diabetes during uh, your future lifetime. So regardless of the type of diabetes that you have, movement, education, and long-term care are essential for the management. Movement, education, and long-term care are essential for proper management of your condition. So why does diabetes affect the whole body? So chronic high blood glucose or high blood sugar will damage tissues gradually. So it gradually damages the tissues within the body. And the key systems that are affected include the nervous system, the musculoskeletal system, the cardiovascular system, and the skin and the healing process. So let's begin with the nervous system. So with the nervous system, diabetes will cause peripheral neuropathy. So this is whereby you develop paresthesia or feeling of numbness and loss of sensation in the lower extremity. Then there's reduced sensation. The ability to feel decreases. Then balance impairment. It also influences balance. As I said earlier, balance is influenced by three factors. We have the vision, we have the vestibular system, and the proprioceptive system. The proprioceptive system is the system that is responsible for the sensation, for the sensory feedback. So with the diabetes affecting the nervous system, it will interfere with the proprioceptive uh, activities of your body, and this will cause balance impairment. Then you have musculoskeletal system, which is another system that is affected. And with diabetes, you will develop joint stiffness. You have the mobility of your joints decreases, then muscle weakness. Of course, this comes with peripheral neuropathy, which means that the nerve supply to your muscles decreases and it leads to weakness. Then reduced endurance. You are unable to endure activities over a period of time. So those are uh, the complications that arise in the musculoskeletal system following diabetes: joint stiffness, muscle weakness, and reduced endurance. Then the cardiovascular system, there will be increased heart disease risk. So diabetes is one of the conditions that leads to cardiovascular issues like myocardial infarction. Then that it can also lead to stroke, usually arise from uh, diabetes. Then there is also a risk of coronary artery diseases with diabetes. Then reduced exercise tolerance. So you are unable to tolerate exercise over a period of time. Reduced exercise tolerance. Those are some of the complications that will arise in the cardiovascular system. Then skin and healing. So there's slow wound repair. So if you develop a cut or a wound in your body and at the same time you have diabetes, there will be slow wound repair. Then there is high infection risk. You develop a high risk of getting infections with diabetes. This comes with the increased sugar levels the within the tissues. So those are the systems that are affected with diabetes. I said that The reason why diabetes affects the whole body is that chronic high blood glucose sugar will damage the tissues gradually, and the key systems that it will affect will include the nervous system, where it will manifest in the form of peripheral neuropathy, reduced sensation, and balance impairment. Then in the musculoskeletal system, it will lead to joint stiffness, muscle weakness, and reduced muscle endurance. Then the cardiovascular system, it will lead to increased heart disease risk and reduced exercise tolerance. Then in the skin and healing, it will lead to slow wound repair, high risk of infection, and those are the complications that arise within the system. So this is why diabetes management will go far beyond medication. This is why diabetes can not only be managed by medication alone. So let's look at the functional impact of diabetes on daily life. So for patients, diabetes can affect your walking confidence. This occurs with the decrease in the proprioceptive system, peripheral neuropathy, and reduced sensation. Then there's balance and fall risk. You get a risk of having balance problems and falls. Then your work capacity. This occurs due to reduction in the exercise tolerance and endurance, muscle endurance, which will affect your working capacity. Then physical independence. Your physical independence will be affected and it will decrease, and all these will lead to poor quality of life. So that is how the diabetes will affect or impact the daily life of the patients. It decreases your working confidence, it leads to balance and false risk, affects your work capacity, leads to decrease in physical independence and poor quality of life. So for clinicians, functional decline often will precede major complications. So anytime you will notice that there is functional decline before the major complications occurs, then early rehabilitation may change the outcomes that are related to diabetes. So early rehabilitation should be stressed earlier in diabetes. So what is the role of exercise and physical therapy in diabetes? So global guidelines from the American Diabetes Association emphasize physical activity as a cornerstone of diabetes care. So physical activity is a cornerstone of diabetes care, and it comes with several benefits. The benefits of exercise with the diabetes include improvement in insulin sensitivity. So the insulin receptors in the cells that are responsible for the insulin production, they will have increased sensitivity, and with improvement in the sensitivity, your blood glucose will become maintained. Then it lowers your blood glucose levels. As you exercise or as you engage in a physical activity, your blood glucose levels will decrease. Then enhance circulation. This occurs as you perform aerobic exercises, then improves balance and strength. So remember, with the diabetes, there comes a problem with the balance, there comes a problem with your proprioceptive system, which decreases your sensation. So with engagement in physical activity, you will gain an improvement in the balance and strength, then supports the mental health. Physical activity is overall considered good for your mental health. So those are the benefits of exercise that comes with. So those are the benefits that comes with engaging in physical activity. Improvement in insulin sensitivity, decrease in blood glucose, enhancement in circulation, improvement in balance and strength, and support in the overall mental health. So physical therapy will focus on number one, aerobic conditioning. So in aerobic conditioning, this is whereby you engage in physical activities or exercises that will aim to increase your exercise tolerance uh, and improve your circulation. So these will include aerobic activities that you may include static cycling, walking, running, jogging, cycling, swimming. Those are some of the aerobic conditioning exercises that will improve your exercise tolerance and overall help with your diabetes. Then strength training. So this whereby your physical therapist will engage you in strength training activities to improve your muscle endurance and your muscle strength. Then balance retraining. Balance retraining, this can be done if your balance has been uh, impaired, extremely impaired. This whereby you may begin with uh, the parallel bars. Then as you progress to, as you do the parallel bars, you do it together with the mirror biofeedback to provide that visual feedback. Then you progress to things like Romberg walking, single leg stance, then dynamic balance training. Then there's gait training. So gait training usually occurs in conditions whereby there is impaired gait with diabetes. Remember, with diabetes, it can also lead to amputation, and with amputation, there must be gait training. There must be efficient gait training to ensure that you can be able to become independent again. Then there's foot care education. There is foot care education. In foot care education, this is whereby you may be provided with things like insoles, then you may be advice on the best shoes to use. So for clinicians, exercise prescription must be individualized. So every patient or every client with diabetes, it is important that the exercise prescription be individualized. Then let's now look at diabetic neuropathy and foot care. So one of the most common complications that come with diabetes is diabetic neuropathy. So diabetic neuropathy will manifest with the following symptoms. So there's numbness. Numbness is whereby you do not feel any sensation totally. There's complete loss of sensation. Then there's tingling and burning sensation. Tingling and burning sensation. So this is whereby you will feel things like pins and needles. Then there is loss of protective sensation. There is loss of protective sensation. So those are the symptoms of diabetic neuropathy. There's numbness, there's tingling, there's burning pain, then there's loss of protective sensation. So physiotherapy and education may help by number one, improving your balance. So physical therapy in diabetic neuropathy will aim to improve your balance. They will aim to improve your balance. They will aim to reduce your risk of getting falls. They will teach you on safe movement strategies. Then they will prevent ulcers and amputations. Remember, ulcers and amputations are one of the serious complications that arise with diabetic neuropathy. So in ulcers, this whereby an ulcer is basically a wound. So if you get a wound with diabetes, I said that the healing process will become slower. So it is difficult for the wounds to heal. So with the physiotherapy and education, there will be prevention of ulcers progression and also progression to amputation. Then patients should also inspect their foot daily. So if you have diabetes, you should always inspect your foot daily. Before you put on your shoes, you should always inspect your foot daily. If you do not feel any sensation in your foot, you should always consult with your clinician. Then what are the lifestyle factors that may influence the control of diabetes? So effective diabetes care will include lifestyle factors. So these lifestyle factors will include regular physical activity. So you should engage in regular physical activity. As I said, there are several benefits that come with regular physical activity. There are several benefits that come with regular physical activity. And this uh, I said there was improvement in the insulin sensitivity, decrease in the blood glucose levels, enhancement of circulation, and improvement in balance and strength. So these are some of the reasons why we encourage you uh, to engage in regular physical activity. So this is a lifestyle factor. It is something that you can be able to do by yourself. Then number two is to balance your nutrition. So you should always check with your nutritionist on the best diet that you can take, being a diabetic. Then weight management. You should always manage your weight if you have diabetes. Then the stress control. Always ensure that you are stress-free in case you have diabetes. Then quality of sleep. Uh, Always check on the hours that you sleep. If you have diabetes, you should always have good quality sleep. Then sedentary behaviors will worsen your insulin resistance. So we discourage you from having a sedentary lifestyle. We encourage physical activity, engagement in physical activity. Small, consistent lifestyle changes that you do will outperform the extreme short-term efforts that you look for. So you should always engage in the consistent lifestyle changes. We discourage you from being in sedentary lifestyle. So what are some of the red flags that may need you to seek urgent evaluation from your healthcare professional? So these include non-healing wounds. So if you develop non-healing wounds, uh, or if you usually a wound will begin from a blister, change in skin color, then blister, then there is peeling off the skin as it progresses. So if you have a wound that doesn't heal, always check uh, with your uh, clinician. Then sudden vision changes. If you notice problem with the vision, where you start having blurring of vision, you should always check with your clinician for the best advice. Then chest pains. If you develop chest pains with diabetes, you should check with your clinician. Remember, this may manifest in the form of angina pectoris, in the form of cardiovascular issues, so you should check with your clinician to rule out any possibilities. Then severe dizziness. If you develop dizziness is when you have problems with your balance and you feel you you are like falling. So that is dizziness. If you develop severe dizziness, you should also check with your clinician. And also recurrent falls. So if you develop recurrent falls, check with your clinician. So those are the red flags: non-healing wounds, sudden vision changes, chest pains, severe dizziness, and recurrent falls. Always check with your clinicians. And this is always emphasized with the institutions like the Mayo Clinic. So if you always check on the Mayo Clinic updates, they emphasize on early interventions to prevent disability. So you should always seek early intervention to prevent disability, to prevent the disease progression from disease to disability or to handicap. Then let's look at the multidisciplinary care in diabetes. So for best outcomes, uh, the best outcome if you have diabetes will occur if there is a multidisciplinary care, which will include your physicians, the nurses, the physical therapists, the dietitians or nutritionists, and also mental health professionals. So education will empower patients to self-management effectively. So always check and ensure that you are educated properly to ensure self-management effectively. So diabetes is a lifelong condition, but it does not have to define the quality of life that you have. So with the knowledge, with the movement, with the consistent care and support, people with diabetes can live active, independent, and fulfilling lives. You can live active, independent, and fulfilling lives. So for clinicians, early functional intervention will prevent long-term disability. Early functional intervention will prevent long-term disability. And for patients, always know that movement is powerful medicine. Always engage in physical activity. You should stay physically active. Then stay active, stay informed, and take control of your health. Thank you for your time.